Welcome everyone to the Dayton VA Medical Center's Women's Health Services webinar. We're thrilled to have so many participants on today's session. I'd like to start by saying this event is being recorded. So if there's something you missed and later want to rewatch it, you'll be able to do that. We'll be providing you a link to the event afterward. You can also share that link with anyone you feel may benefit from the information you hear tonight. I'm Brandon Zita with the Community Outreach Office at the Medical Center. I'm a Marine Corps veteran and, like many of you, once had many questions about VA healthcare. So let's see if we can answer your questions this evening. Please realize that as a participant in this session, your microphone has been muted to minimize distracting background noises. We have quite a few participants on this session and would like to keep that noise to a minimum. Again, this is solely to ensure there is not excessive background noise. This does not mean we don't want to hear from you. If you have a question or concern, you can share it with the panelists at any time through the chat pane. You should be able to find this pane in the bottom right of your screen. Simply type in your questions and a presenter will get with you as soon as they can. For the sake of time, if we don't get to your question this evening during the presentation, you can reach us by phone or email, and we'll provide that contact information at the end of the presentation. Now we'd like to take a few minutes to have our director, Mr. Mark Murdoch, introduce you to your Dayton VA Medical Center.
Hi. I'm Mark Murdoch, Air Force veteran and director of the Dayton VA Medical Center. I'd like to welcome you to the Dayton VA, one of the largest and most historic veteran medical centers in the nation. This campus began as a soldier's home in 1867, providing medical services and rehabilitation to Civil War soldiers. Though the campus has changed over the years, our purpose is not. Just as President Lincoln instructed all those years ago, our mission remains to care for him or her who shall have borne the battle. We do this by putting you, the veteran, at the very center of every decision we make. Whether it's the revitalization of our historic grotto and the healing gardens, the addition of a new MRI suite and simulation center, our community-based outpatient clinics, which were designed from the ground up with our veterans' needs in mind, our complimentary valet parking for our veterans, or the construction of a new Fisher House to give you and your loved ones the ability to rest and recover with all of the comforts of home. Your physical, mental, spiritual, and emotional needs are at the heart of every step that we take. Here at the Dayton VA, we carefully balance our historic significance as one of the first centers for veteran health with the medical needs of the veterans of today and tomorrow. We are proud of our more than 150 years of dedicated service to those who gave us the freedoms we enjoy today, and look forward to spending the next 150 years continuing on the path President Lincoln laid out before us. Thank you for coming to the Dayton VA Medical Center, where we are honored to provide the best possible care to our nation's heroes. You served us, now let us serve you.
History of veteran care here in Dayton. This year marks the 75th anniversary of the modern Veterans Administration. We are proud to be not only one of the oldest campuses, but also boast one of the newest and most modern medical facilities offering top quality care. Not many people know that the VA is recognized, according to a study done by RAND, as being one of the top medical care systems in the nation. It's also top rated by the veterans who it serves, with a more than 98% satisfaction rating. This is a benefit that not everyone is able to receive. This is only available to veterans. And that's one of the reasons we are here tonight. For those who are not enrolled with the VA, we hope you take the opportunity now to do so. It's easy. One way is to visit the Dayton VA Medical Center and stop by the Enrollment and Eligibility Office. They will be glad to help walk you through the process. You may want to call first to schedule an appointment, and that number to call is 937-267-7608. They will tell you then what documentation you will need to bring to determine your eligibility. For the tech savvy, you may also enroll at www.va.gov. Veterans may also reach the National Call Center to apply at 877-222-8387. And finally, veterans may mail an application directly to the Dayton VA Medical Center. You can also enroll in person at the surrounding community outpatient clinics. They are located in Lima, Middletown, Richmond, and Springfield. And we'll share detailed contact information and phone numbers again at the end of the presentation. Now, the reason we're here tonight, let's hear from our subject matter expert who can tell us more about veterans can receive vital benefits from the VA, specifically about women's health services and how the VA is here to help you.
Good evening. I'm Nicole Armitage, the Women Veterans Program Manager at the Dayton VA Medical Center and a 23-year veteran of the U.S. Air Force. Today, I would like to tell you about the services we provide for women veterans and the benefits of enrolling for care at the Dayton VA Medical Center. Historically, VA healthcare was not well utilized by women veterans. In fact, in the 1980s, studies found that most women veterans were not aware of their benefits, were not using VA healthcare services, and that gynecologic and gender-specific services were not available. As a result, the National Women Veterans Program Office was established in 1994 to ensure that women veterans receive timely, equitable, high-quality care in a sensitive, safe environment. Now there is a Women Veterans Program Manager at every VA healthcare system across the nation. As the Women Veterans Program Manager at the Dayton VA, it is my job to work with VA staff internally and our community partners to ensure we are providing the best care possible to our women veterans. For many years now, we've had comprehensive primary care for women veterans. We have providers who are designated as women's health primary care providers at the main Dayton facility, at each community-based outpatient clinic, and our satellite clinic at Wright-Patterson Air Force Base. These providers have experience caring for women and provide the full spectrum of primary care to include wellwoman exams and gender-specific disease prevention and health promotion. When a women veteran enrolls for care at the Dayton VA, she is assigned to a designated women's health primary care provider. Primary care providers are part of a clinical care team known as a Patient-Aligned Care Team, or PACT. Enrolling with the PACT means access to high-quality, comprehensive health care that all enrolled veterans receive. This comprehensive care includes access to a team of providers, nurses, and medical support assistants who are familiar with your unique healthcare needs. PACTs also have dedicated mental health, social work, clinical pharmacy, and nutrition specialists who are integrated with the team to provide care as needed. At the Dayton campus, we have a separate primary care clinic called the Women's Comprehensive Health Center. People often refer to this as the Women's Clinic. The Women's Clinic is a primary care clinic specifically for women veterans. 3 PACT teams are located in our Women's Clinic, and they have only women veterans on their panels. This clinic has a separate entrance and waiting area from the other primary care clinics. This is a great option for women who want to receive primary care in a separate location where only women come for care. Currently, we have over 2,000 women veterans enrolled to this primary care clinic. In addition to primary care, we also have women's health specialists who provide GYN services in the women's clinic. This includes wellwoman exams, evaluation and treatment of common GYN problems, contraception counseling, and management and treatment of menopausal symptoms. We also have many specialists throughout the facility who provide gender-specific care. For example, we have a women's health chaplain who provides spirituality care and holds spirituality groups specifically for women veterans. We have a women's health pharmacist who provides information such as on medications that could be harmful during pregnancy, and recommending alternatives for childbearing women. We also have an interpersonal violence coordinator and a military sexual trauma coordinator. And we have a physical therapist who specializes in pelvic floor physical therapy. As you can see, we have many healthcare services for women veterans. However, there are some services that are a covered benefit but are provided by our community partners. Some examples of types of care referred to the community are breast cancer screening, maternity care, expanded GYN care, and infertility care. When a veteran needs these types of services, her PACT will coordinate with other care teams outside the primary care system and collaborate with the VA's Office of Community Care to ensure veterans receive care based on the most up-to-date clinical care guidelines. For example, if a veteran needs a mammogram for breast cancer screening as recommended by the American Cancer Society, her primary care provider will order a referral to a breast imaging facility in the community. The staff in the Office of Community Care then coordinate that care outside the VA and ensure that results get back to the PACTs. The PACTs stay engaged with the veteran throughout the process and will make sure the veteran receives her results and any follow-up that is needed. Another example is maternity care. I have found that many veterans aren't aware that maternity care is a covered benefit because we don't provide it at the VA. However, similarly to breast cancer screening, if a veteran becomes pregnant, her care will be coordinated through her PACT. Her PACT may first order a pregnancy test and ask her some questions to determine her estimated due date. Then her PACT will order a maternity care consult that is coordinated through the community care office. In addition, the information goes to our Women's Health Navigator, who then follows the veteran and facilitates care throughout her pregnancy. The Women's Health Navigator will contact the veteran multiple times throughout her pregnancy and determine what her specific needs are. The Women's Health Navigator will coordinate with prosthetics to order such things as breast pumps, nursing bras, and maternity belts. She will also facilitate any care offered at the VA that is needed outside of routine maternity care, for example, to see a physical therapist or a mental health provider. Then, after the baby is born, the Women's Health Navigator will collaborate with the veteran's PACT to ensure a smooth transition back to primary care. Infertility is another VA benefit. If a veteran desires to achieve a pregnancy but has been having difficulty, then her PACT will refer her to an infertility specialist in the community for further evaluation. The VA covers the cost of evaluation and treatment, such as ovulation induction or intrauterine insemination. The VA may also cover advanced infertility services, such as in vitro fertilization, if the veteran meets very specific criteria. If a veteran needs advanced GYN services, such as hysterectomy or GYN oncology, then either the veteran PACT or the women's health specialists can refer to the Cincinnati VA, where there are several gynecologists and GYN surgical services, or out to the community. As you have just heard, the Dayton VA offers extensive care for women veterans through primary care, in-house specialists, and in partnership with community providers. As a veteran myself, I was pleasantly surprised to find the comprehensive care now available for women at the VA. I think you too would find that it is an excellent choice for care. Please don't hesitate to reach out to me for any questions about services for women veterans at the Dayton VA. Thank you for your time.
That was a great presentation. With many questions veterans have about their health care and quite possibly misunderstandings, that's one of the reasons we are hosting this webinar tonight. VA is not only dedicated to providing the best care possible for our veterans, but also help better understand their unique needs. The VA is here to help. That's why we have brought in our expert to help answer your questions. We have with us live this evening Dr. Nicole Armitage, who serves as the Women Veterans Program Manager at the Dayton VA Medical Center. She is responsible for leading the delivery of care for the growing population of women veterans who are eligible for and receive care at the Dayton VA healthcare system. Dr. Armitage is also a women's health nurse practitioner with over 30 years of experience. She retired as a colonel from the U.S. Air Force in 2020 after 23 years of service, during which she was a nurse scientist and a nurse practitioner. While on active duty, Dr. Armitage provided direct care to thousands of military women and was involved with numerous research studies involving military women and veterans. Again, I am your host, Brandon Zito, with the Medical Center's Community Outreach Office. I'm a Marine Corps veteran and will help answer any questions you might have about the Dayton VA Medical Center in general. So now we're going to take some time to answer your questions, and we've already received a couple in the chat pane. Please remember, if you have a question, feel free to ask by typing it into the chat pane, which is in the bottom right of your screen. We'll get to you as soon as we can with the time remaining. If we don't get to your question, please know we still want to answer it, and we will give you a way to contact us at the end of the presentation. So the first question, and I will answer that one, it comes from Marcy, and it asks, are there still restrictions for coming in for an appointment? And this is COVID related. And so Marcy, yes, masks are still required and are available in dispensers when you enter the medical center. The temperature checks, which used to be conducted by our volunteer services team, have been done away with. Near the dispensers, there's a COVID-19 self-screening upon entrance. And if you're exhibiting COVID-19-like symptoms, you're asked to exit and to contact your care team. Family members can accompany veterans to their appointments, but children under the age of 5 are not allowed. We have a second question. And being asked is, can I request a female primary care provider? Turn that over to Nicole.
So the answer is yes, you can request a female primary care provider. And if you're not enrolled, then you can just request to enroll with a female provider. If you don't have a female provider now and want to switch to one, you can request to do that as well. We have female primary care providers at all of our facilities, with the exception of the Wright-Patterson Satellite Clinic. There's only one primary care provider there, and it is Dr. Sueda, and he is not a female.
Okay, thank you, Nicole. Next question being asked by Lindsay. How can I enroll with a provider in the Women's Comprehensive Health Care Clinic?
So when you enroll for care, whether you do that by any of the methods that Brandon already mentioned, then you can at that time either request to be enrolled with one of the providers in the Women's Health Clinic, or if they are calling you to set up appointments, you can request it at that time as well, and just let them know that you'd like to be seen in the Women's Primary Care Clinic to get your primary care.
Okay, thank you very much. Another question is, what are the recent changes to patients checking in at the VA? So I will answer that one. Yes, the VetLink kiosks are no longer available for veterans to check in for their appointments. That has been done away with those kiosks. Instead, veterans need to check in for their appointments by scanning QR codes in the lobby or texting check-in to number 53079 on their smartphone. For those veterans who do not have a smartphone or prefer to check in with a staff member, they will be able to do so still. And posters are up in the check-in areas to inform veterans. So as you come into the medical center, you'll be able to find out more. Kiosks will remain for travel until September 29th of 2022, so a couple more months. And veterans at the C-Box will continue to check in using kiosks until September 29th as well. So you've got a couple more months at the C-Box. So Nicole, we have another question. What can I expect if I have a well woman exam?
So the well woman exams are like you might have a well woman exam anywhere. And so that really involves seeing your provider. It could be your primary care provider, or if you're enrolled to a primary care provider, they might refer you to the women's clinic for it. And it's basically just doing an assessment and getting some of your history, focusing on your GYN history, and doing a well-woman exam, like such as Pap test if you are due for Pap screening, or breast exam if you're due for breast cancer screening, that kind of thing. And then just talking to you about whatever needs or concerns that you have, and ordering any appropriate tests, just like you would have had well-woman exam anywhere.
Tiffany is asking what GYN services are provided.
So we basically have some specialty GYN services, but really sort of office gynecology. So we have things like contraceptive management. We do IUD insertions or other contraceptive management. We also do assess for menopausal symptoms and treat menopausal symptoms. We treat and evaluate common GYN problems such as vaginal infections or abnormal bleeding, that sort of thing. So we also can treat abnormal pap smears and evaluate for abnormal pap smears or any concerns like that.
Okay, thank you. Allison is asking, how do I get a referral for maternity care?
Okay, so the first thing to do for someone who thinks that they might be pregnant or knows that they're pregnant is to contact their primary care team. And their primary care team will ask them a few questions like, what is your last menstrual period? Or, to kind of determine about how far along in pregnancy the person is. And then they put in a referral to the community care office. And the community care office will then contact the patient to talk to them about where they might want to receive prenatal care. And then we'll help facilitate setting up their initial appointments for prenatal care. And sometimes it's possible that the primary care team might order a pregnancy test just to confirm pregnancy prior to doing the referral, but not necessarily. It really depends on the circumstances.
Okay, thank you. Madeline is asking, does the maternity care benefit cover the baby?
So it does cover the baby for the first 7 days of life. The idea is, to get through the hospital stay, the initial hospital stay that the mother and the baby would have. And then after 7 days, then the baby is no longer covered under the veteran benefit.
Okay. Caroline has asked, if I must be referred to the community, can I choose whichever provider I want?
You can request a certain provider. For example, if you've been receiving, particular GYN care in the community and you want to stay with that provider, when you have a referral into the community for that care, you can let the community care office know that you would like to continue to see that particular provider. Usually that's not a problem to accommodate that. If there are, it doesn't cover every provider. So, if there are, we have to make sure that we have some kind of partnership with them, or that they do accept, the VA benefits and bill the VA for those services. But for the most part, it's not a problem. You just need to let the community care office know when they contact you to set up those appointments.
Okay, thank you. Regina has asked, what if I need to have procedures not available at the VA?
So if there are any procedures that we don't offer at the VA, what we will do is refer you out to the community, or possibly to another VA that does offer those services. For example, we do a lot of referrals to the Cincinnati VA for GYN concerns, because they have a full GYN clinic with several gynecologists and also gynecologic surgery. So there's quite a lot that they handle there. But otherwise, we would refer people out to the community to whichever providers are able to do the service that the veteran needs.
Okay, excellent. Melinda is asking, what care do you have for breast cancer or GYN cancer?
So we don't provide GYN oncology here at the VA. So for that, we would refer veterans out to the community to see a GYN oncologist. For breast cancer, we do provide some services. We do, we do have general surgery here, and they are able to provide some surgical treatments for breast cancer. For anything that they aren't able to provide, then we refer out to the community. We also have oncology here at the VA. So after people get through their initial treatment with surgery or seeing a GYN oncologist, for example, for maintenance of care or ongoing care, then they could be seen here at the VA with the oncologist that we have here. And we actually have some really great programs in oncology here that do this integrative medicine and have this holistic approach to treat the whole person for those who are recovering or from cancer or cancer survivors.
Okay, fantastic. So to our attendees, this appears to be the last question we've got currently. So if you have anything else you would like to ask, please do so. Does the VA have any special accommodations for women who must have a hospital stay or a residential facility stay?
Yes, so we make sure that we have, well, we just ensure that the privacy and dignity of all veterans, and that includes women veterans. And so for all of our inpatient, our regular medical surgical inpatient floors, we have all private rooms with private restrooms. We're able to get clothing for women veterans specifically, so they can get that, and toiletries if needed, that are more feminine if people desire. And also for the for example, for the inpatient mental health floor, the rooms are not all private. However, we make sure that women are in the rooms that are next to each other if they have to share a bathroom, and doors can be locked from the inside, that kind of thing, so women can feel more secure. In the residential areas, they have the separate area for the women veterans. So they can, and they also have separate day rooms for veterans. So they do have those accommodations. So again, we want to provide an environment where women veterans feel safe and secure. And I believe we do that here at the Dayton VA and all of our facilities.
Okay, thank you. We've got a question from Patricia. How long do PCM appointments generally last?
So it depends on the type of appointment. So for regular appointments, it would be about 30 minutes. But if you're having an appointment where you're also having your wellwoman exam, for example, then that would be an hour appointment.
Okay. And Patricia also asks, how does Tricare and VA work together?
Okay. I'll try to, I don't know if I have the answers to that question. Perhaps Brandon, you do, but I know that people who are dual eligible, that there's some services that Tricare covers and some that the VA covers. And I know the people that go to the Wright-Patterson Clinic are usually dual covered by Tricare and the VA services. And I think that they have some kind of arrangement where they just determine whether Tricare gets billed or if it's a VA benefit. And I don't know if you have a better answer to that one.
Well, so Patricia, 1 month ago, we had a webinar on that exact topic, on how the VA, Tricare, and Medicaid worked together. And so I have the subject matter expert phone numbers, and I will reach out to you as soon as possible, most likely tomorrow, with either Deborah's or Kimberly's contact information, and they can give you 100% truth answer what you're looking for from them. And so, yeah, that will be what you're looking for as an answer from them. So I will reach out to you tomorrow and get you that information. I've got another question. Are there any plans for the Dayton VA to support the Million Veterans Program? Currently, I would have to go to Cincy to be a part of that.
You know, that's a great question. So I'm assuming that you're having to go there for blood work or to fill out the paperwork, that kind of thing. I know that we refer people, all we do here in Dayton is refer people to the online site to register and enroll for the Million Veterans Program. But I would have to get back to you. As far as I know in the Women's Health Clinic, I don't think we're participating in particular, but let me find out more information so I can get back to you about that to see if we have future plans, you know, so people can get what they need here.
Okay, so to our attendees, we do not have any questions currently in the queue. We'll wait a little bit longer to see if anyone would like to ask something in there. And if not, well, we'll say that's all the time we have for this evening's session, and we hope you found this event both helpful and informative. If we did not get to your question, please don't worry. You can call us at 937-268-6511, extension 2035 or 2195. Again, that number is 937-268-6511. Extensions 2035 or 2195. Or you can call our eligibility and enrollment office at 937-267-7608 for questions about how to enroll with the Dayton VA. Again, there are several options for enrolling with the Dayton VA Medical Center. If you are not currently enrolled but would like to enroll with the Dayton VA, here's how you can do that. In person, online, the call center, or through postal mail. You can also enroll at the surrounding community-based outpatient clinics. And they are located at Lima, Middletown, Richmond, and Springfield. And you can see their phone numbers on the screen. We hope we answered your questions for healthcare and the VA in general and are ready to enroll. Thank you for our panelists for all the great information she shared with us this evening. And thanks again for everyone who attended. Have a great rest of your evening. And thanks to all our veterans for their service to a grateful nation.